Bacterial vaginosis, commonly known as BV, is one of the most prevalent vaginal conditions affecting women of reproductive age worldwide. Despite its widespread occurrence, bacterial vaginosis remains one of the most misunderstood and under-discussed health conditions, often surrounded by stigma, misinformation, and silence. In this comprehensive documentary, presented by WUTNews, we aim to break that silence by providing accurate, science-based, and easy-to-understand information about bacterial vaginosis, its history, causes, transmission patterns, prevention strategies, global distribution, health risks, and long-term consequences. This video is designed not only to educate, but also to empower viewers with knowledge that can help protect personal health and promote informed decision-making. Whether you are a student, healthcare worker, or someone seeking reliable medical information, this documentary will offer valuable insights into one of the most common, yet neglected women's health conditions. Historical background of bacterial vaginosis. The medical understanding of vaginal infections dates back thousands of years, with early references found in ancient Egyptian, Greek, and Roman medical texts. However, bacterial vaginosis as a distinct medical condition was not clearly identified until the late 19th and early 20th centuries. In 1892, the bacterium Gardnerella vaginalis, previously known as Haemophilus vaginalis, was first described. For decades, BV was mistakenly referred to as nonspecific vaginitis because it did not fit the classical definition of fungal or parasitic infections. It was not until the 1950s and 1960s that researchers began to understand that BV results from an imbalance in the vaginal microbiome rather than a single infectious organism. Modern molecular research has since revealed that bacterial vaginosis is a polymicrobial condition involving multiple anaerobic bacteria, including Gardnerella vaginalis, Atopium vaginae, Mobiluncus, and others. This breakthrough reshaped how BV is diagnosed, treated, and prevented today. What is bacterial vaginosis? Bacterial vaginosis is not a traditional sexually transmitted infection, but it is strongly associated with sexual activity. It occurs when the normal balance of bacteria in the vagina is disrupted. In a healthy vaginal environment, beneficial bacteria known as Lactobacilli dominate and help maintain an acidic pH that protects against harmful microorganisms. When these protective bacteria decrease, harmful anaerobic bacteria multiply rapidly, leading to bacterial vaginosis. This imbalance can cause noticeable symptoms or remain completely asymptomatic, making BV a silent condition in many cases. How bacterial vaginosis develops. The vagina is a complex and dynamic ecosystem. Any disruption to its natural balance can trigger BV. Several factors contribute to this disruption, including unprotected sexual intercourse, multiple sexual partners, vaginal douching, use of scented soaps or intimate hygiene products, hormonal changes, smoking, stress, and weakened immunity. BV is not caused by poor hygiene, and excessive cleaning can actually increase the risk by eliminating protective bacteria. Modes of transmission. Although bacterial vaginosis is not classified as a classic sexually transmitted disease, sexual activity plays a significant role in its development and recurrence. BV can develop through sexual contact with a new or multiple partners, exchange of vaginal fluids, sharing sex toys without proper cleaning, same-sex female sexual activity. It is important to note that BV can occur in women who have never been sexually active, which further emphasizes that it is a bacterial imbalance rather than a traditional infection. Signs and symptoms. Many women with bacterial vaginosis experience no symptoms at all. However, when symptoms do appear, they may include thin, gray, or white vaginal discharge, a strong fishy odor, especially after sex, vaginal itching or irritation, burning sensation during urination. Because symptoms can be mild or absent, many cases go undiagnosed and untreated. Health complications and risks. If left untreated, bacterial vaginosis can lead to serious health complications, including increased risk of HIV and other STIs, pelvic inflammatory disease (PID), complications during pregnancy such as premature birth and low birth weight, post-surgical infections after gynecological procedures. BV also increases susceptibility to other vaginal infections, making it a significant public health concern. Global distribution in affected countries. Bacterial vaginosis is found worldwide, affecting women across all ethnic, social, and economic backgrounds. However, prevalence rates vary significantly by region. Higher rates of BV are reported in sub-Saharan Africa, South and Southeast Asia, Latin America, parts of the United States and Europe. Limited access to healthcare, lack of sexual health education, cultural stigma, and socioeconomic factors contribute to higher prevalence in developing regions. Diagnosis and medical evaluation. BV is typically diagnosed through clinical examination, microscopic evaluation of vaginal discharge, pH testing, laboratory-based molecular tests. Self-diagnosis is not recommended, as BV symptoms can resemble those of other vaginal infections, such as yeast infections or trichomoniasis. Treatment options. Bacterial vaginosis is usually treated with antibiotics such as metronidazole, clindamycin. Treatment can be oral or topical depending on severity. However, recurrence is common, highlighting the need for prevention and lifestyle modification. Prevention strategies. Preventing bacterial vaginosis involves maintaining a healthy vaginal environment and adopting responsible health practices, including avoiding vaginal douching, using condoms consistently, limiting sexual partners, avoiding scented intimate products, attending regular medical checkups, following prescribed treatments fully.
education and awareness are critical in reducing recurrence rates. Living with and protecting against BV. Women who experience recurrent BV should seek professional medical guidance. Lifestyle adjustments, stress management, and improved sexual health practices can significantly reduce recurrence. Open conversations, regular screening, and breaking social stigma are essential steps toward prevention and early detection. Public health importance. Bacterial vaginosis is more than a personal health issue. It is a global public health concern. Addressing BV contributes to reducing maternal mortality, preventing STI transmission, and improving reproductive health outcomes worldwide. Final message and call to action. Understanding bacterial vaginosis is the first step toward prevention, early treatment, and better health outcomes. Knowledge empowers individuals and communities to make informed health decisions without fear or shame. Please, if you found this documentary informative and educational, please support our mission by subscribing to the WUTNews YouTube channel. Your subscription helps us continue delivering trusted health documentaries, medical awareness videos, and global public health education to audiences around the world. Subscribe to WUTNews today and stay informed, protected, and empowered through knowledge.